For this question, a 19-year-old female complaining of considerable amount of knee pain, has minimal swelling, no gross deformity at the left lateral knee joint. The patient states that she twisted her knee stepping off a 3-foot bleacher. Assuming the patient has injured only her ligaments, what is the most likely type of injury? So for this question, it is just pretty much a memorization question, and the fact that it was just ligaments that were injured, the correct answer is B, a sprain. A sprain is an injury to a ligament. A strain, the reason why that is wrong is strain is an injury to a muscle and maybe even a tendon, but not a ligament. And there'll be a question later on a tendon injury. And then the last two, C and D, are both have to do with fractures of bones. So the answer again is B, sprain, which is an injury to a ligament. And there are three different degrees of sprains. A first degree sprain, which is probably the case for this question, is just simply stretching a ligament. There's no tearing present. There would just be some swelling and pain, and twisting or jamming a joint could potentially cause a first degree sprain. A second degree sprain is caused when there is some tearing, but the ligament itself is intact. So the ligament is stretched, some of the fibers have torn, but the ligament has not torn completely. And that leads us to the third degree sprain, which is complete tear of a ligament. When there's complete tear, there could also be dislocation or deformity of the joint, and with or without fracture to the joint as well. A considerable amount of force is needed for a third degree sprain.